Why?
Well, hey, everybody, thanks for making it into Notary Stars, our little special presentation for health insurance coverage. We have a special guest with us tonight, Delora Snyder. She's been with U.S. Health Advisors since 2020. She's licensed in every state that U.S. Health is licensed in, and she can help with coverage options in any state across the U.S. She's a traveler, currently traveling across the country with her husband and 3 boys in her RV. Woo-hoo. She loves to meet clients along the way and have coffee with them too. She and her family love the outdoors and exploring all the new places they venture. Mostly you're going to find her near any coast in the United States. The beach is her favorite place to be. Delora also loves to read, spend time with her dog and cat. You have a dog and a cat in an RV? Okay. And she bakes too.
And 2 rats.
And 2 rats. Mice? Rats.
No, they're rats. So
Okay.
they're bigger than mice. That wasn't my decision, but I'll say that they have grown on me. And
Right. Now, when you have kids, you've got all kinds of unusual animals in the house, don't we?
That's right.
Everybody, please help me welcome Delora Snyder. Welcome, Delora.
Yay. Thank you guys for having me so much. I look forward to hopefully talking with all of you guys individually at some point, but my main focus for being here is to kind of give you a little bit of a background about what I do and what could be available for you moving forward. So like Beth said, I'm with U.S. Health Advisors. So we primarily work with small businesses or self-employed people or 1099 contracted people. I am a 1099 contracted person myself, so I know the ins and outs and what you guys have to deal with completely. I am contracted with U.S. Health Advisors, but they don't have us as employees, as agents. So I have to get my own health insurance just like you guys do. So, what we do with everybody, since we know that health insurance is expensive and your options out there in the marketplace right now are not real great. Being a self-employed person, your really only options are short-term policies or the ACA. Short-term policies, if you don't know the difference between some of these things, when you hear these terms, you're like, I don't know what that is. A short-term policy is anything that's on the internet that is not us and not the ACA is going to be a short-term plan. And what that means is you have coverage for a little while, whatever the term is, 6 months, 1 year. Sometimes you can find a 3-year plan, but those are hard to find. And when the end of the term comes, they decide again if they want to insure you, but they don't underwrite you. So when they decide if they want to insure you, they look at your past claims. Have you been diagnosed with cancer? Do you have diabetes now? Are you a big user of your insurance just because you like to go to the doctor a lot? If any of those things occur, then they can say, no, sorry, we're not going to insure you. Well, if you have something big like a cancer diagnosis or something like that, or something that Ronnie went through, if you don't have insurance at that point, now you have a pre-existing condition and no insurance coverage, and you have to go to the ACA. That's the only place out there that will insure you. So when I say that we're a long-term company, that means that we are made for individuals and small business owners, and we want you to stay on our plan until you're 65 and ready for Medicare, and we will never kick you off. So it doesn't matter what kind of diagnosis you have. It doesn't matter what you went through. It doesn't matter if you go to the doctor every single day and rack up $1,000 a day in claims. It's okay. We will not kick you off. We do underwrite you at the beginning and during the application process. So you do have to be fairly healthy to get on the plan to start with. And then we have benefits built into the plan to keep you healthy. For instance, we give you accidental death and dismemberment coverage. So you get a little bit of life insurance. on everybody in your family, actually. So it won't just be for yourself, but your family gets to piggyback off of you. So if you have a spouse that has a different, like, corporate type job and they have really good coverage, but you can't be on it because it's expensive for you, that's okay. We can insure you, and your spouse gets to use that AD&D coverage if something like that happens to them. They also have accident coverage that they get to piggyback off of you. So if they have an accident or you have an accident, that part of your plan is going to pay your out-of-pocket expenses on your health coverage. That part of the plan also gives you a teledoc service. So you know as well as I do that when you're self-employed, you're always working. It doesn't matter what you're doing, you're always working. You're on vacation, you're working. You're eating dinner, you're working. If a client calls, you're working. So having a teledoc service is really important. I actually thought that I would never use it. We use it all the time. I'm so thankful that I have it. It allows you to call a doctor anytime, anywhere. I like to say it's a doctor in your back pocket. And for me, who travels, I'm currently in California right now. Our home state is North Carolina. So I am nowhere near our regular doctors right now. So if we get sick, I just pull out my doctor in my back pocket, no matter what state we're in, and I can get virtually diagnosed, prescribed meds, and everything right on the phone. So you don't have to leave work, you don't have to leave your house, you could just do it. It takes less than 10 minutes. It's great. So that all of those benefits your family gets to piggyback off of. And then when you're talking about health coverage, some really important things that you're probably looking for is the ability to choose whatever hospital or doctor you want to go to. That's a really big thing. You don't want to lose the doctors that you've already built a relationship with that you have right now. So you won't have to change. You can keep them. And then if there's one of those big diagnoses that we keep talking about, and you need either of the Mayo Clinics or MD Anderson in Texas, or whatever other specialist, the best neurologist in the country, you have access to all of those hospitals, doctors, and specialists. So you can go where you want to and where you need to go to get the treatment that you need. I know that a lot of people are like, well, what's my deductible going to be? Can I afford to pay my deductible to go be seen? So, sometimes people are like, well, I'm not going to go to the doctor because I can't afford it. I haven't reached my deductible, so I'm not going to go. Well, you will have a deductible with our plan. And it's a lower deductible than you'll get with the ACA. And there's some different options. So when we meet together, we'll go through those options so you can find the right balance for yourself. But in addition to that, we also give you some first dollar benefits. So yes, you'll have a deductible, but we want you to stay healthy. We don't want you to get sick. We don't want you to have a big diagnosis. We want you to go to the doctor when you're not feeling good. So we give you benefits at the beginning of each year so you can go to the doctor even before you touch that deductible. And when we meet together, I'll fill you in and show you exactly how that works so you understand it better. But I go to the allergist every year. I have allergies and asthma. So I have to go, and I'll actually show you my EOB where you get $100. I get $100 to go to the doctor with, and the doctor only cost me $63. So it's fully paid for, even though I haven't touched my deductible yet. I've also used the accident coverage 3 times with my family since I have all boys, and I'm clumsy myself. One of them was for me. um, So, I am a user of the coverage, so I know very well how it works. With that being said, since it is an underwritten plan, there might be some of you that don't qualify for that specific plan. We do have another plan that's not underwritten, so I can insure everybody. And then sometimes, when we talk individually with everybody, insurance is not one size fits all. So sometimes there might be a time where I say, you know what, the ACA really is where you need to be because of XYZ. And I'll help you kind of determine that and help you find a plan that really does work for what you need. As a health insurance advisor, I'm not just some agent that's out there. I'm your advisor, and we're going to look at all of your plans that are out there and available to you, and decide together. Obviously, you'll make the final decision. It's your health insurance. But I'll bring you all of your options that you qualify for and that are out there for you, and help you look at each different one and explain it to you, so that you can decide what's going to fit for you or your family. And we do help small businesses too. So if you are somebody that has employees, or maybe your spouse does, we insure very small groups, definitely under 50 people. But most of my groups, well, all of my groups right now are under 20 people. And probably 90% of my groups are under 10 people right now. So we don't do the large, big time groups. I'm going to pause there because that's a lot of information, and see if any of you have any questions or specifics that you want me to go over.
I absolutely do, Delora. So first off, let me say, when you're referencing the ACA, that's the Affordable Care Act. So that's Obamacare. That's
Obamacare, yes. And open enrollment is getting ready to start November 1st. So I know that probably a lot of you are headed there to see what's available for 2024's coverage. Before you sign up for something, make sure you talk to me.
So you can also help them navigate ACA if that's the only options they really have, maybe based on pre-existing conditions or something like that, right?
Exactly. Or if they qualify for a subsidy. A subsidy is where, the ACA, Obamacare, is based on financial status. So they take your household income into account. And if you're below a certain level, then you qualify for a subsidy. And that just means that the government is going to help you pay your monthly premium for health coverage. And if you qualify for a subsidy, sometimes looking at other plans is, I don't want to say pointless, but if you have a plan that you can get for free or $50 a month, it's going to be really hard to outweigh the benefits of paying $600 or $700 or $800 a month. We do not base our health insurance off of income. Now, most self-employed people make too much to qualify for a subsidy. So probably most of you are not going to be in that situation where you do get free health coverage, because you have to be below poverty level or near poverty level for that. But if you do, we'll look at those options. And, some things to keep into account is, maybe you do get free health coverage, but your family deductible is $17,000 for the year. And so if you have to pay $17,000 for the year before you get any kind of assistance with your health care, as well be paying for a plan, because that's well over $1,000 a month. So, I kind of help you look at those things. Another thing to mention is, if, let's say you have a family of 5, like I do, that's easy. And let's say somebody has diabetes. That is a person that I can't insure, or cancer. So they have to go to the marketplace, and that's where that person should be. The marketplace is a comprehensive plan. It takes full care of you, even though you have a pre-existing condition. But if you put your whole family on there, then, like I said, you have a $17,000 deductible. Well, if you only put that person on there, like myself, my deductible now will only be $7,000 or $9,000. So we need to get the rest of the family on a different plan, so that the person who needs the ACA and is going to definitely reach that deductible saves $10,000 for the year. So we'll look at those things too. So that's going back to what I said before. Insurance is not one size fits all. Everybody has different needs. And Ronnie, did you have a question?
I did. I didn't want to interrupt you, which is so unlike me, but I wanted to ask you if with these plans, and we talk about one size fits all, that's what I kind of think about the marketplace, that they just, everybody fits into, you're getting everything. So like, whether you are planning on having a child or not, you are paying for insurance that will cover you if you have a child. Whether you're having back surgery or not, you're paying for the probability of that in the marketplace. With your insurances, to my understanding, your insurances are based on an individual's needs. So I may only need major medical. I may only need, a small policy supplemental. Your policies range in prices because you're picking out the components that you actually need for health insurance, correct?
That's right. That's right. Our plans are fully customizable. So when you get the medical portion of coverage, you will have a comprehensive plan. And, the difference between comprehensive and indemnity, comprehensive means it's what you're used to. You have a deductible and an out-of-pocket max. And once you reach that level, the insurance company pays everything else. And that's really what you want. You don't want an indemnity style plan. That's backwards. That's where the insurance company pays first and they pay a certain amount and then you pay everything else after that. And that can get really dangerous really fast. Like if Ronnie had that when he went through his situation, the insurance company would have paid very little and then he would have been in the same boat, honestly, almost as not having coverage. So you have to be really careful. So you do want the comprehensive plans. So when you look at medical with me, you're going to be looking at a comprehensive plan. But let's say you have comprehensive coverage with your spouse and you don't really need medical coverage, but you're interested in the teledoc or the accident coverage or life insurance or critical illness benefit or disability. I can help you with each of those things, vision, dental, each of those things separately. So you don't even have to need the full package if you have that elsewhere. So that is an option.
Do these health insurance plans that you have, for instance, someone like myself, I go to physical therapy once a week for my back. After getting ran over by a car, I'm never going to not need massages or chiropractics. Do you have plans that cover things like this? And another thing, and I'm very candid about this with the Notary Stars community, I actually go to two different therapists. I go to a business coach, and then I also go to a personal therapist where I work things out in my life so that I can do things. Do your health insurance plans have components that you can add in if you needed mental health coverage or, things like chiropractic and massage, which are not usually covered by even some major medical?
Right. So yes and no. If you were to get hurt after you have our coverage and you needed physical therapy or something because of an accident while you were covered with us, then yes, some portions of physical therapy would be taken care of for you or helped along with your deductible. As far as chiropractic appointments, we do have benefits in there for you. So everybody can go see a chiropractor if you want to. That's part of those first dollar benefits I told you about. So you actually get those before you reach your deductible. So yes, you can go see a chiropractor. It does not cover the massage portion of chiropractic care. So that part will be out of pocket for you. But, if you don't price shop your medical stuff already, you definitely should, just like you price shop your bread and your milk when you go to the store to buy groceries. It is the same thing. And if you need help price shopping, you all are going to have my cell phone number. It's listed on the website. And when you contact me, I make sure you have that saved in your phone. And I can help you with that. I can help you price shop, even if you don't end up being a client of mine. Mental health, that is something that we don't cover. Mental health, the only place you can get coverage for mental health is the marketplace, the H.S.A. But there again, yes, they cover mental health after you reach the deductible in most cases. So even though they cover it, you are paying tons of money out of pocket before you get that coverage. Most people that need mental health coverage, now you go to therapy, so I'm sure that that's probably $100 a visit or something like that. So you would have to pay that out of pocket. But if you're on any kind of like anxiety medicine or something, those are typically very inexpensive prescriptions with good RX. And when you talk with me, we'll go over your medications and exactly what you need. And like I said, maybe this might not be a fit for you, but we won't rule it out. We're going to look and I'm going to tell you, well, your prescription is going to cost you this much when you go. And typically it's like $4 a month, unless you're on like Vyvanse or something like that. Those are expensive medications. And we do have with that teledoc service, you do get 3 free mental health visits a year. So if you're not somebody that is a regular user, but you just have a problem that you need to get worked out or something, you do have access to those as well. And you can continue using them after, and I don't know what the price is. I think it's $60 an hour or $90 an hour. So it is still beneficial for you, even though we don't technically cover mental health.
Wonderful. Ms. Laura, I just want to make an announcement real quick. If you guys are here today and you have questions about for Ms. Laura that would, if you're interested in health insurance, this is not a sales call. She's not going to sign you up for a plan because you ask a question, but this is a wonderful time to ask any questions, and your question may be in the back of the mind of another notary as well. If you have questions, please get your hands raised and get into queue. I would personally like to know, to start off questioning, what kind of price range do you see, for small business owners that are healthy? What we talk about affordable rates, what are we seeing in comparison to the marketplace for plans that you are working with?
Sure. So that's a really hard question to ask. Our rates and any health insurance rates out there are based on age, whether or not you use tobacco, whether or not you have high blood pressure, your height and weight is taken into account. So I can tell you for me personally, I just turned 40 and my health insurance is about $400 a month. And that's fully loaded, but typically when you compare our coverage to the marketplace, we're typically 40 to 60% below the marketplace rate. So if you've gone on the marketplace before or talked with somebody through Obamacare, and you've gotten like a $1,500 quote for your family, most likely you'll be in the $1,000 range, 800 to 1,200, somewhere in that. Now, that's without looking at any of those specifics that I said. So it's definitely a range and it definitely depends, but we're typically 40 to 60% lower than the marketplace.
Okay, that's really good to know. We do have a question for you from Zena Hall. Ms. Zena, if you'd like to ask your question, we'd love to hear it.
Thank you. I am a cancer survivor for the last 11 years, and I always hear the pre-existing condition response. I'm wondering when I get out from under that label.
So it depends on what type of cancer you had and how it was treated. But first of all, congratulations for beating that and being in remission. And then secondly, you're probably good now. If you've been in remission for 11 years, probably no matter what it was, if you're not taking medication for it anymore, in radiation, and you've been in remission for 11 years, then you should be good. 10 years is the mark for most cancers. But there are a lot of cancers like skin cancer or a tumor that was surgically removed. It depends on what it is, but some of them are only 2 years. So it just depends on where it was, how it was taken care of, what it was, and how long it's been. But those are typically 2 years or 10 years. But I think you're probably out of that window either way.
Okay, thank you.
Yep.
Now, Ms. Laura, I did post your website into the chat for the notaries, and I'll also put it onto the replay, and this will be available in our resources section at Notary Stars, so that if you are interested in contacting Mr. Laura, and I already know the answer to this question because we did a pre-interview to have Mr. Laura here today, but how accessible are you for people to schedule appointments, and how do they actually schedule? Do they just call or email, or do you have a scheduling feature on your website where they can pick a time?
Yes to all of those. So I just posted my Calendly link in the chat. So that's the easiest way to just go ahead and schedule an appointment that works for you, with whatever time. But if you don't see a time there that works for you, or you don't want to use that app or whatever, you can send me a text message to my cell phone. My cell phone, like most people, it's glued to my hip, so I'll answer very quickly. That phone is better than my office phone. My office phone number is listed there and I do check it every day, but when I'm done working, I'm done with that. So I won't get it again till tomorrow. My cell phone, you can text me in the middle of the night. And I tell my clients that too. Text me, call me anytime you want to. When I go to sleep, I do turn my sound off, but as soon as I wake up in the morning, I go back through and check all of those things. I'm super readily available. If I'm doing stuff with my family, I have my cell phone on me. And as long as I have cell coverage, because sometimes we're places where I don't have cell service for a little while, but as long as I have service, I'll call you back and answer you. You know, there's people that get hurt or have a situation on a weekend, and I'm there for you, which is another thing you don't get with the ACA or those short-term plans. You don't get an agent that's like, hey, I'm here. I really am your agent. I love if you are my Facebook friends, so you guys should look me up on Facebook. Here, I'll put that in here too. That way you can keep track of where I am. And like Beth said, I do meet a lot of people for coffee and stuff like that. So clients that I've never met before, I go hang out and we get to know each other. You guys can follow my family there and everything. So I'm super available.
Wonderful. And we have another question from you from Kelly. Kelly, we'd love to hear, I'm sending a Facebook request, but we'd love to hear from you. Kelly, we're not hearing anything there. Good, Kelly, we can't hear anything, so if you want to type your question into the chat, we'll be happy to ask that question for you. And then Ms. Beth, you have your hand raised. Do you have a question that that you'd like to ask?
Yeah, I was just thinking that not a lot, a larger percentage of our notary base are doing this as a second career, Delora. So in that respect, can you also help navigate that Medicare supplement program?
So I don't write Medicare policies right now, but I do have a colleague. Her name is Faith. So if there is something that I cannot help you with, Medicare being one of them, I'll definitely get in touch with her and she'll reach out to you. So yes and no. I can't personally write the Medicare plan, but I can definitely help you get linked up with somebody that can.
Perfect, thank you.
And oh, go ahead.
I was saying I can see Kelly's question here. She was asking if she can design a preventative only care plan, and do you offer dental and vision? So preventative care comes with your policy, and if that's something that you're most interested in or is most important to you, then you're just going to have to get the comprehensive plan, but we can increase your deductible so that you have more of a catastrophic type plan, if you will, where if something does happen to you, you have more out of pocket to pay, but it will take care of some of those doctor's visits, chiropractic care, prescriptions, and wellness visits and things like that. To do that. So we can look at doing that. But as far as preventative care, you know, in the insurance world, we're like, you know what, everybody can kind of typically afford to go see the doctor when you need to see the doctor for sick visits, even your well check and mammograms and colonoscopies. We don't want to have to pay for those, but we can if we need to. Insurance really is designed to be the what if something big happens type of thing, and that's what you want it for. So yes and no. You can have a plan that they all have preventative care with them, comes with, but you can increase your deductible to make it where you need to be, to have it solely more for just preventative. And then yes, we offer dental and vision. So you can put your whole family on dental and vision, even if they're not all on health coverage. You do not have to have health coverage with me to get dental and vision. So yes, we can do that. We also have life and we also have disability.
I have a quick question before we go to the next two notaries that have their hand raised. And I don't know this. I would like to know this answer. Is health insurance tax deductible for business owners?
So that is a question for your accountant. because that is not my cup of tea.
Okay.
And fun fact, I did go to school once for accounting, but I didn't finish. I love math, and that was just too business for me, so I opted out. But anyways, everybody's business is structured differently and set up differently. So whether or not it's taxable depends on your business specifically. And so that's why it's a question for your accountant.
Okay, and before we go to the next question, I just want to let everybody know, Miss Delora is not some rando person. You know how Notary Stores operates. She was actually referred to us by Amy Seitz, someone that we all know and love and trust for notary education. And they met because, as we said at the beginning of this, everybody knows Amy loves her RV and RV life, and they actually met at a campsite. And I believe she is a client of yours, if that's okay to say. Or is she a client of yours or working on it?
She's looked at it
Mhm.
for future. She's not yet a client, but we've chatted about it.
I know that she's moving more into the RV life, and that's how that you guys met. But you know, at Notary Stars, we don't just bring in anybody to try to sell things. We keep a community of trust, and that she came highly recommended as we were looking for a new insurance rep for Notary Stars. Let's go to the next question from Abraham. Abraham Zamora. You guys all know Abraham.
Hey, Ronnie. Hi, Delora. Can you guys
Hi.
hear me okay?
Yes.
Good. Okay, I have a few questions, but I'll just kind of rapid fire them at you. You said open enrollment starts November 1st. When does that end?
So there's 2 dates. So as far as for mine goes, first of all, we don't have open enrollment. You can sign up all year long.
Okay.
But for the marketplace, it starts November 1st and it ends December 15th for coverage starting January 1st. If you don't make it by then, you have until January 15th to have coverage start February 1st. And then that's it. After that, you won't be able to get coverage. One note here that's good to know, if you're thinking that you might want to talk to me, you should do that sooner than later, because if for some reason you were denied with our plan, we want to make sure that you have enough time to get to the ACA before they close that enrollment period. So even though we don't have an enrollment period and you can sign up every time, you don't want to wait till the last minute. I've had clients come to me like December or January 14th and they're like, okay, I need coverage. And then January 17th, they were denied and now they can't go to the marketplace. So don't wait. Make sure you come talk to me so we can discuss and decide where you need to go while you have time.
Okay, good. Now I missed the first 5 minutes of the conversation. You may have mentioned this. So you're offering private insurance as opposed to the marketplace, or you
That's
have both options. Okay. And then to qualify, you said it's not income based, it's based on your health. Is that correct?
Yep. So
Okay.
any coverage outside of the ACA is going to be based on health for the most part. Some short-term plans, well, honestly, short-term plans don't look at your health when you sign up. But when you go to use the plan, that's when you get underwritten. And that's when they say, sorry, we're not going to cover that because you've had a past history of that, which is another reason why they're risky. But yeah, the marketplace is the only one that doesn't look at your health. Like, really, you can go there no matter if you have cancer right now or, you need back surgery tomorrow, you can use the marketplace.
But for the private insurance, your income is irrelevant.
That's right. So
Okay, now. Okay, I'm sorry, go ahead.
nope, you go ahead.
Yeah, okay. How do you guys check that? Does someone come out and draw blood and weigh you and that kind of stuff? Like, is it like life insurance to
Nope.
qualify?
Nope,
No.
not typically. So what we'll do is we'll go through the application process and I have all the underwriting questions. So I pre-underwrite each person. And I go through all those questions with you so that you have any yeses or maybes. We talk about it and we decide if it's relevant or not to put it on your application. When we put what we need to on the application, the underwriters call you, they verify all that information. And then if they decide, they also pull your MIB report, which is your that's the Medical Information Bureau, I think. And they
Right.
pull your prescription history for the last 5 years. So they can see anytime you've picked up medicine, what medicine it is, the dosage, who prescribed it, how often you picked it up, were you on time picking it up, things like that. And they pull that MIB report too. So if there's something either that you said or is on one of those reports, then they might call your doctor and get medical records. And so then they'll verify what they need to verify at that time. Sometimes if you're somebody that, let's say you were a smoker, a tobacco user, and you say on your application, no, I'm not a tobacco user, I quit 2 years ago. They might make you verify that by going and getting a test done at a certain place. Or if you haven't been to a doctor recently, which none of my clients fall in this because I pre-underwrite you and I make sure that you know what the right answers are and make sure that you have seen a doctor. As long as you've seen one within the last year or two, you're going to be good to go. But sometimes I have clients and they're like, I haven't been to the doctor in like 6 years. Those people might have to go get a urine and blood test done, but it's rare.
Okay. And then family plans. Yeah, again, I may have missed this, but wife and kids, there are plans to cover the whole family.
That's right. Yep.
Okay. And then how does this healthcare savings plan fit into all this? Is there a way of strategically using that as like Ronnie's question with tax advantages and that stuff? Is that something you can answer?
Yep. So H.S.A plans, so we are not technically H.S.A qualified. If you have an H.S.A already in place, I wouldn't cancel it and I would just use it. Nobody has time to go through and check all these things. But if you're planning to get health coverage and an H.S.A, started kind of at the same time or whatever, then our plan technically is not H.S.A qualified.
So then I wouldn't be able to get one after the fact,
And
or I wouldn't
not
be able to use it, I guess is what you're saying.
Yeah, I don't want to tell you that you could, because the correct answer is no. You
I
can't.
see.
But our plans are made, and you probably missed maybe this. We have first dollar benefits built into our plan
Oh
where
yeah, I
yes,
got
you
that.
have a deductible, but we give you money at the start of each year, and that kind of mimics the H.S.A plans. You have money to pull from. So I have 3 kids and I go for my physicals every year. My kids go for their physicals every year, and I've never touched my deductible. We've had 3 accidents. It's the plan is built so that you are not having to take money out of your savings account every time something happens or you need to go to the doctor. And so those first dollar benefits mimic the H.S.A type plans. And when we meet together, we can really dive in and get more specific on exactly
Okay.
how it works, but it's kind of built in already.
Excellent. All right. I made an appointment for Saturday. We'll see you at 3.
Okay, great. I look forward to it.
Okay, bye now.
Perfect. Next hand up is Miss Roz Smith from Missouri. Go ahead and unmute, Roz, and ask your question.
All right. Hello. Thank you for this presentation, you as well as Ronnie. This is perfect timing. I hit the magic 50 last year. So you can imagine what I was hit with a couple weeks ago, double my rate.
Yes.
So I just signed up, but I'm really interested to see, what this really covers because I'm relatively healthy, thank God. And I'm a preventative person. I love, I get my checkups and do all those things. So I am shopping right now. So I just want to say thank you. And I already signed up.
Okay, good.
Yeah.
Very good.
Awesome. Perfect. Thank you, Roz. Tara Hall. Tara, go ahead and unmute yourself and ask your question.
Hello, thank you. My question is, I currently have insurance through my employer. I'm a nurse by trade for about 20 years now. So I'm transitioning out of that and have done a lot of work. And this is something that I hadn't thought of. So I was very pleased to run across this earlier on my email. Are there discounts for nurses or first responders or anything like that that someone would take advantage of if they are still using that as a backup?
Right. There's not any discounts per se, just for specific careers. or hobbies or anything like that. But that first part of coverage that I told you about, that national association or network, that kind of is your discount plan. By being part of that, it drops your rates lower because you're in this large group with 16 million other Americans, and that's where you get the lower rates. So you're used to having coverage that is discounted at the hospital or the doctor's office where you work because you're part of that group. And then your employer helps you pay it. So you're not used to having to pay for your health insurance. So you'll probably be sticker shocked when we talk, but you're used to that. And we don't do it per se per whatever industry you're in, but by being part of that network, it is discounted.
Okay, excuse me, that's helpful information. And actually, I'm not used to that. And that has been one of the challenges because I'm a travel nurse. So I
I
do
was
have
just
to
going
find
to
my own
say, if you're,
insurance.
yes, I do have
So,
a lot of travel nurse clients, actually. I'm in a group on Facebook for travel nurses, and that is a question that comes up every day. And the other thing with travel nursing is your contracts stop and then you don't have coverage. So you're constantly changing coverage. You go for periods of time, maybe with no coverage, which is crazy risky. And so a lot of travel nurses get private coverage so that they don't have breaks in their coverage. They don't have to change coverage. It's more affordable. It's better for their whole family, yada, yada. So yeah, I'd love to chat with you.
okay, that's great. And I do have another question, and if we should wait, but it may be helpful for other people because I have different entities that I work with. Luckily, I don't have to change insurance, but I have found one that I have been able to keep that is primarily office visits over the phone, basically, and they help me find a provider that's willing to work with them. And you probably know better what exactly that's called. Sometimes it can be challenging because they don't necessarily approve it. It's a really great company. It's inexpensive, and it's user friendly, but the work being done on the back end. So how does that work with the insurance that you provide? Where's the hub for that? Where do you start when you want to make an appointment? Do I need to call to make an appointment at the insurance company like I do now, or will I make that with my doctor's office and they already know who these companies are? Are these big companies?
Okay, I think I know where you're going, but I've not heard of a company doing that before, so I might need better clarification or more clarification. But no, if you have a doctor that you like, I can tell you when we get together if they're in network or not.
Gotcha.
Big thing is anybody who takes United Healthcare, you're going to be in network, which is pretty much everybody in the country. So that's good to know. When it comes time, like if you go to a new area or now you need to start seeing a dermatologist or something, if you need recommendations, you can call me and I can provide you a whole list of people that are in network, and then you can look at their reviews and where they are and stuff and decide if you want to go see them or not. But I can help you with that. You do not have to ask the insurance company to see anybody. So it doesn't matter if they're a specialist, a hospital, a doctor, anything. You do not need a referral. If you want to go somewhere, you go.
Okay, that's great. Yeah, that's what I run into with this, unfortunately, for the first time. And I don't know if anyone else has experienced or you've heard of it. I had a physician for over 25 years with a large part of Centera. However, because my insurance is not taken by her, now that she's not private, I'm not allowed to see her and pay cash because they know I have insurance. So
Right.
I thought I was pretty savvy with figuring out these little ways to go about things and try and get it affordable, but that hit me like a ton of bricks. So
Yeah.
United Healthcare, so it's an umbrella with United Healthcare.
Kind of. So United Healthcare is our parent company. So we're a
Gotcha.
subsidiary of them, and United Healthcare focuses primarily on short-term plans, like we talked about, and really large group benefits. So hospitals, schools, UPS, things like that. And so they don't do what I do. So they have our company to help with the very tiny groups and long-term individual plans. So yes, United Healthcare is our parent company, so we use their network.
Okay. All right. That's very helpful information. I appreciate that.
Yeah, you're welcome.
Thank you.
All right, everybody, I want to encourage you, we've been posting in the chat, both Miss Delora's website and the Calendly link where you can schedule a 30-minute meeting with her to learn more. The purpose of this session is to kind of point you in the right direction. One of the biggest takeaways that I heard tonight is 40 to 60% less than the marketplace. That, you know, I'm sorry, in this economy, I thought about this and I'm going to start calling you Deal Laura because that sounds like a deal to me, especially if you are in a position where you need health insurance and you can't have it or you don't have access to it. I literally was paying $800 a month for health insurance. Luckily, you know, due to being married, I'm paying very little with a military spouse, but health insurance is a thing, and we all have to kind of think about those things as business owners. As business owners, we have to be healthy. And, you know, if I know there's a lot of husband and wife teams, I actually know that there's a husband and wife team, at least one half of that in here tonight, which means if you're both notaries, you probably may not have health insurance that is affordable. So I encourage you to schedule that appointment. If you haven't been to the chat yet, I'm going to post it one more time. Delora also posted her, you know, Facebook, which I just became Facebook friends with you, into the meeting. So please make sure to grab that link. You can also download the chat in order to grab those links. But I'm going to ask all of you, please. We have a guest that is not a part of the notary community that came here to talk about something that we all need. If you would not mind turning on your cameras for just a moment, and let's give Miss Delora our signature wave. Make her feel welcome for being here with us tonight. And, you know, don't be shy. I know some of you might be cooking dinner or things, but just pop over to the camera and let's give that signature wave. Make sure she knows that she was welcome here tonight. Thank you guys for all of you that provided questions. You know, if you didn't have any, that's okay. But thank you all for those of you that provided questions. And Miss Delora, I want to invite you, you know, to come back, you know, ever so often and kind of keep us updated and, you know, remind the notary community that they have access to health insurance. If you are looking at the replay, all you have to do is pop over to notarystars.com, click on the resource section and look for health insurance for notaries. Ms. Delora is going to be our new placeholder on our website for notaries to access health insurance. And by the way, guys, this is not a membership thing. This is for the entire notary community. This is not part of our membership. We're not making any commissions off of this. We just wanted to point you in the right direction in case you needed health insurance. So it doesn't matter if you're a member of Notary Stars or not, that page will be accessible to you, to the entire public. Anybody that's browsing our resource section will have access to Miss Delora. So thank you so much for being here with us today. And I hope all of you have a wonderful night. And I look forward to the relationship that you're going to build with us, Miss Delora, and all the notaries that are going to turn to you.
Yes, thank you so much for having me.
Thank you. Everybody have a wonderful night.
Bye, guys. Thanks, Delora.
You're welcome.